guys, welcome again to Health Focus with Amy. Thank you for always following up. I urge you to kindly subscribe, kindly share, kindly like, and I promised last week that today we are going to focus about issues with eyes with our very own Jane, who told us that she has worked so much in the ophthalmic unit and she has a lot of information on ophthalmology. We are going to see what happens when you're diabetic and what happens when you're hypertension to the back of your eyes. Come with me and let's look at what Jane has. You're welcome again to the discussion we had previous week. This is the video. If you've not watched that video, surely. Okay, let's focus with what Jane told us last week. She has worked in the eye unit for so many years, she can't even count them. She's seen so many patients coming with complications of diabetes, complications of hypertension. To anybody who has hypertension and diabetes, they always advise you come every year for checkup, right? Because hypertension and blood and diabetes spoil the eyes. So what is it that is happening at the eyes if you have hypertension and diabetes? Welcome, Jane. She has the eyeball with her and she would like to explain what it does. Those things.
Okay, thank you, Emily. Yeah, as you can see, this is an eye, and don't imagine, this is an eye, and when you look at it from outside, it's just a normal eye. And this is exactly what happens to patients with diabetes. When they look at you, you see the normal eye. There is nothing that will tell you that patient has a problem. But most, or what I've seen in the eye, most diabetic patients, they may not know they have diabetes. Why? Diabetes doesn't pain. Hypertension or high blood pressure doesn't pain. And that's why sometimes they are called, like hypertension is silent killer. It doesn't pain. So we find most of our patients, they are coming, the complaint is, I can't see.
Yeah, blood vision.
Sister, I can't see. Doctor, I can't see. When I look at people, I'm seeing like there's a shed behind. Somebody is very far. So maybe when the doctor takes history, is like, do you have blood pressure? No, unless you check. That's the time sometimes we check.
The pressure is so high.
Blood pressure is high. Blood sugar is high. You ask the patient, have you been experiencing this? Okay, some will say, yes, we had signs. I keep on drinking water. I'm feeling thirsty. I eat, but I feel hungry. But nothing clicked in the mind. Will this be diabetes? So sometimes our community are suffering from lack of knowledge. So they come, now when they have reached the eye clinic, the doctor will find something else. Also, we have those who are already known they are diabetic patients. But because of 1, 2, 3, they don't know that diabetes can still affect the eye. And also we have facilities in the periphery, maybe who are not telling these patients that once you are diabetic or you have hypertension, you need eye checkup twice in a year if you can. If you can't, once.
But are people aware? Are even the health professionals aware?
That is a debate we have.
Scream to the camera and make them aware, like, kindly.
So my humble request, if you are a nurse, you are a clinic officer, maybe working in health facilities, in health centers, you will get patients having blood pressure, diabetes, however controlled it is. Please inform them to go and see an ophthalmologist,
once or twice,
not a keratometist.
Who is a keratomist?
These people who sell
specs,
or they call them optician, not opticians. Please, an ophthalmologist who will have time to check the vision of this client of yours or patient, put drugs in the eye, to open the eye, or they call it dilating, then check the back of the eye. That is where the damage from blood pressure, from diabetes happens. It doesn't happen the outer part of the eye. It happens behind.
Okay, using the eye enable us, you know, not everybody has worked in the ophthalmic area since we finished school. This is the eye you have.
Yes. Now, when I'm saying the eye, okay. When we talk of the eye, this is the front part. That's, we call it the anterior. But we are saying complications or damage from blood sugar and hypertension happens at the back of the eye or the posterior. So as I open this one, now how can I hold it? Now when I hold it like this, this is the front part. So when a patient has blood sugar, mostly which is not well controlled, the damage will happen here. And this part is called the retina, and these are the retina vessels. We have blood vessels and blood arteries that they are there. They supply the retina with blood through the main vein,
Which takes to the brain and the major blood vessels.
Yes. And this is a very special nerve, the optic nerve, that enables me and you to see. So when anything happens here, the nerve is also affected. Yeah, it is also affected. So the main, when there is when the blood pressure or the blood sugar, mostly let's just talk of blood sugar, when it is so high, the retina gets a lot of blood supply. And in that process, there's a new growth of vessels. These are the main permanent, but because of the changes of blood sugar in the retina, there will be growing new blood vessels. These blood vessels are not permanent, they are fragile. So anything small, they will bleed. Okay. So when they bleed, the bleeding will be in the retina.
In the retina. And the retina should not have blood.
Because it should be a clear
fluid.
Yes. There's an aqueous fluid inside which is clear. So when when there is bleeding in the retina, and in the retina we have so many parts. We have the macula, which I can't tell you here. The macula is what makes us see. So once there is blood, you will see patients telling you, I can see a shadow. So this shadow is the bleeding in the eye. Because we know the eye has clear
aqueous fluid.
But because of the bleeding, it will now bring the shade.
The shadows and shades.
Yeah, the patient will see here, I'm seeing shade. When this bleeding continues, then maybe the blood sugar is controlled. It goes down. Wherever that vessel bled, it will make a scar.
Wow. At the retina itself.
Yes, they will start making something like scar. But we don't call them scars, they call them exudates.
Okay.
So when these scars continues, the retina will make something like fibrosis.
Wow.
Then it will start pulling. So you see now how
fibrosis to a layman is those, okay, like a kidonda, a wound, when it heals, then the tissue that grows now is fibrous.
Yes,
it's not elastic.
Yeah, it can't stretch. Yes. It starts pulling. Now once it pulls, because the retina is so fragile, that's the time we'll get patients, the doctor say the patient has retinal detachment.
So it is pulled from the original,
where they will do exudates, they pull.
Wow. Wow.
That is one thing you'll say, find the patient is seen, there's retinal detachment happens.
Then now you just start seeing like a curtain is passing before your eyes.
Yeah, patient will tell you, Sister, I was walking or I was sitting and I saw something like
Fall.
a curtain fall. For ophthalmic or for ophthalmology, that is an emergency.
Yeah,
Yes.
that's an emergency.
So all these things happens. Mostly the diabetics are at risk. Often than
like all the time.
Yeah, like no other person. Still when the blood sugar is high, because in the eye we have a lens, natural lens.
This is the lens.
Yeah, this one now. A natural lens, which is very clear. When the blood sugar is high, this lens intends to absorb water.
From where?
When the sugar is high, you remember what they should now.
Okay, the cell, that's the cell physiology, which most laymen will not understand. But it's like putting salt outside an apple, it pulls water out of the apple.
Exactly.
Okay.
So when it gets that water, and this...
So it pulls water from the cells.
From the cells.
Okay.
It will make this lens from being clear to opacity.
That's cataract.
Now the patient will get cataract. So those are there are so many complications from diabetic, but those are the major that is leading to many patients becoming blind. Now patient comes maybe with a retinal detachment, which is total.
4-week-old.
Yeah, total. And you know it is not paining. It's like, I'm not seeing. Oh, I will go. Now with this, even the economic status we are having, people, and maybe it is one eye. You are like, see, the other one is seeing. But before this patient comes for the other one is also affected. So my maybe advice is, let diabetic patients go for checkup. Anything you see, even you can't open your eye, it is not normal. Don't take it, it is normal. Any blood vision you are seeing, it is not normal. Go to the doctor, let the doctor tell you it is okay.
True. Because again, what I wanted to highlight is there are not many doctors of retina in Kenya.
Yeah.
There are not many.
And it is a very expensive.
It's a very expensive procedure.
surgery.
And the retinal detachment, it's like when it has totally detached, there's nothing you
There's
can
nothing
do.
you can.
So you are blind. That is
When there is when the retina bleeds, they can either do lasers.
Yes.
These lasers can prevent once, but if you are not controlling your sugar, it will still bleed.
Again.
It will still bleed, and it bleeds sometimes so much that the doctor has to go in and wash out the blood. The blood because it's too much. The patient is not seeing. When the blood in the retina is too much, there's increase in pressure in the eye.
Oh yeah, there's so many.
There are so many. So
There's
the
so
doctor
many
goes
things.
in to wash the blood. It is also cost implication. They call it posterior vitrectomy to clear out the blood. Still, we don't have many surgeons.
We don't have many surgeons.
Yeah, you will come, you will find a very long queue.
In fact, I wanted to tell the viewers that the retina washout, in most cases, in the clinic like where we are, in PCA Kikuyu Hospital, let me highlight it, in a clinic day we have more than 100 patients.
Yes.
And these more than 100 patients are not minor patients. They have complications, it's major. It's major. So to all diabetics in the country, because we know there's so many diabetic patients, statistics show like in every 10 patients, in every 10 diabetic patients, around 5 have eye issues. Let's do checkups. Yeah,
if we get, and also us who are working in health facilities, let us make our clients be aware.
Yes.
It's better you give information, but let nobody to follow, or maybe the patient is reluctant, but you have informed. Let us do our part of teaching these patients.
True.
Teaching our diabetic patients, our hypertensive patients, we need our back of the eye being checked yearly.
So when they go do laser, what is that to somebody who doesn't understand what laser is?
Okay, there's laser which burns those fragile blood vessels we talked of. Because of the persistent high sugars, there are vessels which grow on the retina. So the doctor, when they are not very much, the doctor will decide to do laser. This laser will burn those fragile vessels and seal them so that they will not bleed again.
Okay.
But the bottom line is control blood sugar.
So a well-controlled sugar necessarily might not have the vessels growing.
Yes, when it is well controlled. But some might be found with it,
Even when
which was there before. You know, sometimes you come and control blood sugar late, or you notice you are diabetic after a long time. Yeah, those are some patients you find them with all those complications.
Okay. True.
Because they didn't know.
True.
There are so many times that patients have come to I only to be diagnosed they are diabetic. And because the patient came maybe because of cataract, I'm not seeing well, you see.
Sure.
That's why I say it. And you see, like, diabetes runs in families.
True.
If my mother is diabetic, my father is diabetic, let us not
Screen
have that
for
culture
diabetes.
of screening ourselves.
Because it's like DNA gene current.
Yeah.
Okay.
So
Alright.
it will help. Then let's teach them where we get this patient in our outpatient. Let's talk about diabetes.
Let's sensitize every single Kenyan.
Yes.
We are sensitizing even in this video. Like, kindly, if you are coming from a family that has a diabetic, kindly, if you're diabetic, do yourself a favor. Check yourself in an ophthalmic unit. Just do a checkup. Checkup of diabetic is even 500 shillings.
500
Where we are. Even look for us.
Check
Look for
your
us.
blood sugar.
Check your
And
sugar.
even you might be told your blood sugar is controlled. Okay.
It's okay to
But
be-
have your retina checked
Exactly.
every year.
Even pressure check.
The pressure check every year. And from the age of 35, people are encouraged to be checking blood pressure. You never know when it will knock in.
True. Because these conditions are very painless.
Painless. That's the major thing.
They're very painless. We are so grateful, we are so honored to have had Jane. We are so privileged to have such kind of knowledge being transmitted. It will never be lost if it's given from one generation to another. Now that she's a lecturer, a tutor, sorry, she's kind of giving information to those young girls coming up, and she's given you information. If you're working in a health facility, tell those clients, sensitize them, and let us all kill this issue before it becomes a complication. We are going to have next week a consultant of this retina issues. Kindly, let's get hooked in and we will all learn together. Thank you for watching. Thank you for subscribing. Thank you for commenting. Thank you for supporting a sister. And may the Lord bless you.